Hi, I'm Bill Faulkner, and on behalf of the ISMRT, I'd like to welcome you to our MR Safety Week checkup. This year, for MR Safety Week, we would like to encourage you to look closely at your facility's MR safety practices. And to do that, we're going to provide you with a short video each day during MR Safety Week that will give you suggestions for areas to assess. We hope that you're going to always keep MR safety as a main focus in your practice, but we think MR Safety Week is a great time for a checkup. And in this video, we're going to focus on MR safety policies and procedures. The information is based on the ACR guidance document on MR safe practices. I've got the reference here from the Journal of Magnetic Resonance and Imaging. Now, if you don't have access to this or you don't have the most recent copy of this document, I encourage you to go to the ACR's website and download it. The access is free. All clinical and research MRI sites, doesn't matter the magnet format or field strength, and this includes installations for diagnostic imaging, research, interventional, or even surgical applications, all should maintain MR safety policies. These should be reviewed along with the introduction of any significant changes in safety parameters in your facility. For example, you have a new magnet, you have a new room, you have a new area, you have an upgrade to the gradients, you have an upgrade to the RF. So anytime any of these changes are made, that's a good time to review your policies and procedures. Make sure they're current. You should also take into account any national or international standards and recommendations before you establish local guidelines and policies and procedures. It's always a good idea to stay in touch with the MR community to see if there have been any changes to standards or recommendations. And membership in the ISMRT, I might add, is a great way to do that. Each site needs to name an MR medical director, and a big part of the responsibilities of the MR medical director is to ensure that MR safe practice guidelines are established and maintained as current and appropriate. So, do you have an MR medical director? Do you know who it is? Do they know they're the MR medical director? This is a good place to start. Now, it's the responsibility of the site's administration to ensure that these policies and procedures that result from these safe practice guidelines development, that these are implemented and adhered to at all times by all of the site's personnel. I hear this a lot from sites. Well, we have a lot of policies and procedures in place. We have our policies and procedures. Well, that's really good, but here's kind of the key point. How's compliance from the staff? How's compliance from the support personnel? Do people choose when they follow policies? Are they consistently followed? Now, this list of certain main headings, if you will, of policies and procedures is not meant to be inclusive, all-inclusive, but I took some of the main headings from the ACR guidance document, and this is what I would recommend as kind of a bare minimum start, that this is what you need. You need policies and procedures that address these areas. For example, the safety zones and restricted access to the MRI area, specifically zones 3 and 4. You need to have annual training in place for MR personnel. Screening policies and procedures for patients, non-patients, and support personnel. And again, these need to be enforced. They need to be followed consistently. Here's a big one: patient preparation, including dressing patients in MR appropriate attire. I see this a lot. We have a policy in place. Do you always do it? Well, no, not always. What about patient positioning and padding, using appropriate padding to prevent burns? Do you have policies and procedures that address medical emergencies and how to emergently remove a patient from the MRI environment? Quench policies and procedures, when to quench, who's allowed to determine to quench. Do you even know where the quench button is? Are your quench pipes, the vent system, is it adequate? Has it been checked? What about clearing implants and devices? What are your policies and procedures on that? Does every technologist understand the procedure, and is it followed? Sedation, patient sedation, and monitoring of patients. Again, you need to have policies and procedures in place. Drug delivery patches, how are these assessed? Who determines how that they are to be removed? What about making sure that they're put back? I mean, these are just some of the things that it's important to have a very clear and concise policy and procedure for. And we're going to address some of these areas individually in upcoming videos in MR Safety Week. So again, all facilities, regardless of your format, regardless of what you do, should have and maintain current MR safety policies and procedures. So again, we hope that you'll take this week, today especially, to take a look at your policies and procedures and make sure that they are current and that people are compliant with these policies and procedures. So that brings us to the end of this first video in our MR Safety Week checkup series. In the next checkup video, we're going to look at safety training and education. So until next time, this is Bill Faulkner. Thanks for watching, and take care.